All right, so the first area we're gonna palpate is the ulnar head. So this is the most distal point of the ulna. Most people refer to it as the wrist bone. It's right here. It's pretty prominent. It sticks out pretty far.
All right, so to find the medial epicondyle, we're gonna find the olecranon process, and then we're gonna move medially, and we're gonna fall into a divot, and we're gonna come back up on top of a bone, which is gonna be the medial epicondyle.
All right, so next we're gonna palpate the greater tubercle. So to find the greater tubercle, you're gonna wanna go as proximal as you can on the humerus on the lateral side. And you're gonna find this bony landmark that sticks out a little bit. Most people will refer to this as the tip of the shoulder, and that is the greater tubercle.
Right, so to find the AC joint, we're gonna walk our fingers down the spine of the scapula until we get to the acromion process, which we're gonna find by eventually walking down and falling into a divot. And then we're gonna move anteriorly on the acromion process, and then we're gonna fall into another divot, which is gonna be the AC joint.
All right, so next we're gonna palpate the radial head. This is proximal on the radius, so what we're gonna do, we're gonna start in the lateral epicondyle, and then we're gonna come 45 degrees medially till we get to a little bony landmark. What I'm gonna do, I'm gonna have the patient supinate and pronate their arm, and you should feel a bump, a bone rotating when they go into rotation.
All right, so to find the sternoclavicular joint, we're gonna find the jugular notch, move laterally to find the clavicle, and then we're gonna palpate the area where the clavicle meets the manubrium. And that's your sternoclavicular joint. So to find the scaphoid bone, we're gonna have the patient retract their thumb until you see the tendons of the snuff box stand up. And then located in the floor of the snuff box is gonna be the scaphoid bone.
So next we're gonna palpate the second pip joint. So the second would indicate that this is the index finger or pointer finger. And the pip joint is this middle knuckle right here. This is the primary flexor of the finger. Flexion occurs at this joint.
So to palpate the scapula inferior angle, we're gonna have the patient externally rotate their arm and put their hand behind their back. And then we're gonna see the scapula inferior angle stick out of the back, which we can actually put our fingers underneath and palpate around the bony aspect of the bone.
So next we're gonna palpate the long head of the biceps tendon. So this is in between the greater and lesser tubercle, and it sits right inside the bicipital groove. So next we're gonna palpate the radiocarpal joint. This is in between the distal radius and the base of the scaphoid and the lunate.
All right, so to find the radio-ulnar joint, we're gonna find the ulnar head, and then we're gonna move medially until we fall into a divot in between the ulnar head and the distal radius, which is the distal radio-ulnar joint.
All right, so next we have the shoulder apprehension test. This is used to test for shoulder subluxation. So usually you test on the uninvolved side first, but we're just gonna use the involved side. So what you're gonna do is you're gonna put the patient's arm in at a 90-90 angle, and what you're gonna do is you're gonna push on the posterior shoulder, grab the wrist, and pull it into extension. And so what should happen if this is a positive test is the patient should show apprehension. So what will happen, they might flinch, they might have a look on their face like it hurts. So
looks scary.
Yeah, so this would indicate a positive test.
All right, so we're gonna perform the elbow valgus test. So this is testing for UCL sprain or tear. So we're gonna do it in a closed and open pack position. We're gonna have the patient fully extend their arm, and then we're gonna hold the distal wrist and the elbow, and we're gonna push the elbow medially. And then we're gonna do the same thing in open pack position, where we're gonna hold the wrist, and then we're gonna push the elbow. And if there is any sign of like excess valgus stress, then that would show signs for a UCL sprain or tear.
All right, so next we're gonna do the Allen test. This test is used to test for radial or ulnar artery obstruction. So we're gonna have the patient pump their hand a few times and make a fist. After that, they'll open it, we'll occlude the two arteries. So we got the radial and the ulnar. And what we're gonna do, they'll open their hand and we're gonna release one at a time. So we're gonna release the ulnar. And you'll see a little bit, you'll see the blood rush back into the fingers. So that would be a negative sign. And what we'll do is release the next one. And you'll see the blood come back in. So what we'll do, we'll have them pump their hand again. Occlude both arteries. And this time we're gonna release the radial first. You see the blood rush back in, then we'll release the ulnar. Blood rushes back in. A positive sign would be that you don't see the redness rush back into the hand, which would be the blood.
All right, so to perform the Fabry's test, we're gonna have the patient lay in a supine position, and we're gonna put their leg in a figure 4 position. And we're gonna push down on the medial knee and then the opposite iliac crest. And when we push down, a positive test would be if pain in their SI joint would increase.
All right, so next we're gonna move on to dermatomes. So dermatomes innervate individual nerve root sensory. So first we're gonna do T10. So with T10, I'm gonna have you point to your belly button. Perfect, so with this, we're gonna have him close his eyes, we're gonna do light touch, deep touch, and pinprick. So, does that feel the same? Does that feel the same?
Yeah.
Does that feel the same?
Yeah.
So we're going to test T12, which is sensory innervation of the just superior to the inguinal crease. So we're going to have the patient close their eyes and then ask if it feels the same on both sides for light, deep, and pinprick touch. So same on both sides, same on both sides,
Yep.
and same on both sides.
Yep.
All right, so now we're gonna move on to C5, which is deltoid innervation. So we're gonna have the patient close their eyes. We'll go light touch. Does that feel the same?
Yep.
Deep touch. Does that feel the same?
Yep.
We'll go pinprick. Does that feel the same?
All right, so to test sensory innervation for C6, we're going to test dorsal web space. So we're going to have the patient close their eyes. Same on both sides.
Yep.
Same on both sides.
Yep.
Same on both sides.
Yep.
Then we're going to do C7, which is the tip of middle finger. So same on both sides.
Yep.
Same on both sides.
Yep.
Same on both sides.
Yep.
And then C8, which is going to be the ulnar border of digiti minimi. So same on both sides.
Yep.
Same on both sides.
Yep.
And same on both sides.
All right, so now we're gonna move on to T1 dermatome, which is superior to the medial epicondyle. We'll have the patient close their eyes. We'll go light, deep, and then pinprick. So, does that feel the same?
Yep.
Does that feel the same?
Yep.
Does that feel the same?
Yep.
So we're going to test myotomes now, which are individual nerve roots that provide innervation for motor function. So we're going to start with C7, which is elbow extension and wrist flexion. So we're going to support the posterior elbow and apply resistance on the lateral wrist. And we're going to have the patient push against resistance. Perfect. And then we're going to do wrist flexion. So we're going to support the proximal forearm and apply resistance on the fingers. And we're going to have them flex. Perfect.
All right, so for C8 myotome, we're gonna test finger flexion, ulnar deviation, and thumb extension. So we're gonna support the posterior wrist. We're gonna apply resistance to the fingers, have you go into flexion with the fingers. Nice. So now for ulnar deviation, we're gonna support the lateral border of the wrist, and we'll apply resistance to the ulnar border. So go in, yep, perfect. And then now we'll do thumb extension. So what we're gonna do is have you flip your arm over. I'm going to support the anterior part of the wrist, and we're going to apply resistance to the posterior part of the thumb while we go into extension. Nice.
All right, so to test the T1 myotome, we're going to test finger, ab, and adduction. So we're going to start with abduction. So we're going to have, I'm going to apply pressure on the lateral aspects of the fingers, and we're going to have them try and spread his fingers. Good. Next pair. Good. And next pair. Then we're going to do adduction. So we're going to put resistance to the inside of the fingers. And we're going to have them try and squeeze my fingers together. Perfect. Same thing. Perfect. Same thing. Perfect.
All right, so we're going to move on to the C7 reflex. So with these reflexes, you tap the tendon for the muscle that sends a signal to the spinal cord and creates a reaction without brain function. So for C7, what we're going to do is we're going to bring the arm into like a scarecrow position, 90 degrees. We're going to support the bicep, making sure all your weight is on me, so relax that arm. And what we're going to do is we're going to tap that tricep tendon. And what we're looking for is we're looking for a little jerk or a little reaction of the arm kicking out sideways. So as you can see, he's got a little bit of a reaction to that. So he has the C7 reflex.
Right, next, we're going to test peripheral nerves, which stem off the spinal cord and have motor function and sensory innervation. So we're going to start with the musculocutaneous, which to test the sensory innervation, we're going to stroke the brachium. And then the motor function, we're going to test elbow flexion against gravity. So yep, you can perform elbow flexion on your own. And then I'm going to support behind the elbow and apply resistance on the wrist and go into flexion. Perfect.
All right, so we're going to move on to the radioperipheral nerve. So what we're going to do is we're going to do elbow extension. So we'll go above the head, have you work through your own range of motion first. Nice. So what we're going to do, we're going to apply pressure now. So I'm going to apply resistance to the ulnar border of the wrist, and I'm going to support the shoulder. Go through that range. Perfect. So now what we're going to move on, to wrist extension. So I'm going to have you hold your hands like this. So what I'm going to do is I'm going to put resistance on the back of the hand, and I'm going to support the anterior part of the wrist. One extension. Nice. So next we got finger extension. So I'm going to have you flip. Yeah, that way. And I'm going to have you curl your fingers in, and I'm going to I'm going to support the posterior part of the wrist. We'll start with fingers flexed, and you're going to push against me. Nice.
All right, next, we're going to test the superior gluteal peripheral nerve. By testing sensory innervation, we're going to stroke the inferior aspect of the iliac crest. And then to test motor function, we are going to test hip abduction in a neutral position. So we'll keep the patient in a figure 4 position on the bottom leg to support the upper leg. Have it straight out. And we're going to support the iliac crest and then apply pressure just below the knee. And we're going to have it go into hip abduction. Perfect.
So next we're gonna test the axillary peripheral nerve. So for this, we're gonna stroke the deltoid patch. Then we're gonna have them put their shoulder into abduction. Let's raise it up. So what we're gonna do here is we're gonna apply resistance right below the elbow and support the shoulder. Have you go into abduction. Nice.
All right, next we're going to do manual muscle testing, which we're going to perform in a position against gravity. We're going to perform dynamic and brake testing. So we're going to start with elbow extension. We're going to have the patient put their hand over their head, and then good. So we can see he can move by himself against gravity. Then we're going to apply resistance to the shoulder, or support the shoulder and apply resistance to the wrist. We're going to have him go good with resistance, and then we're going to perform a brake test. So go halfway, and then push against me. Good, which he can do all those by himself, so we're going to grade him a 5 out of 5. And for manual muscle testing, we can either grade him from a range of 0 to 5, 5 meaning he can perform the full range of motion against gravity with resistance, 0 meaning he would have no movement at all, even without resistance.
All right, so next we're going to move on to shoulder abduction for manual muscle testing. So what we're going to do is we're going to stabilize the shoulder, we're going to apply resistance to the wrist, and we're going to go through that range of motion. Nice. So now we're going to do a brake test. We're going to go halfway. Good.
All right, now we're going to perform manual muscle testing for wrist radial deviation. So we're going to have the patient sit down and support their arm on the table, and we're obviously palm side up. We're going to support the medial forearm, and then we're going to apply resistance to the lateral wrist, and then we're going to have the patient do radial deviation with resistance. Perfect. And then we're going to do a brake test, so same resistance and support. We're going to go halfway with resistance.
All right, so next we're going to do manual muscle testing for the erector spinae. What I'm going to do is I'm going to support the posterior pelvis. He's going to lay prone with hands behind his head. We're going to support. He's going to lift his chest off the table. Perfect. He's going to hold that. We'll go back up. We're not going to do any real brake testing. He's going to keep it at the top of the range, and I'm just going to apply slight pressure in between his scaps and push down a little bit. Perfect.